Και κύριοι, καλησπέρα. Χαίρομαι πάρα πολύ που είμαι σήμερα εδώ μαζί σας, διαζώσεις. Είμαι ένας από τους φαν του CoMuseum. Ερχόμουν πολλά χρόνια και ως θεατής, πολύ πριν πάω στο Υπουργείο Πολιτισμού, και γι' αυτό το λόγο είμαι πάρα πολύ υπερήφανος που ως Υπουργείο Πολιτισμού δίνουμε και την αιγίδα μας σε αυτό το πάρα πολύ σημαντικό συνέδριο. Επιτρέψτε μου τώρα να αλλάξω και εγώ γλώσσα, να μιλήσω στα αγγλικά, καθώς οι εργασίες του συνεδρίου γίνονται ως επιτοπλίστων στα αγγλικά. I'm very happy and honored to be here today with you, to be able to share with you what we are designing in this field. We are talking about this as being something super innovative, but is it? I don't know if you know this place. This is the ancient theater of Epidaurus. We are using it actually today even, and every summer we are hosting a lot of theater productions in this amazing theater. What maybe is not that known is that this theater was part of a greater complex, a medical complex, the Asclepion. Part of the healing process that was taking place in this Asclepion of Epidaurus, and there were other Asclepia around Greece, part of this, of the therapy, was actually a part called catharsis. And it was believed that if you watched plays, if you listened to music, this would be a cathartic experience that would actually kind of relieve part of your mental or even physical ailments. So, cultural prescription is super old, as we can see here. So, fast forward 2,500 years later. 2019, the WHO releases this report about health evidence. It's a health evidence report about the role of the arts in improving health and well-being. This report reviewed around 3,000 research projects and surveys on the impact of the arts on health and well-being. I will not elaborate on the findings of this report, because I'm sure there are many of our distinguished fellow speakers will speak about this evidence, but this was the first concise and holistic, let's say, report that WHO issued on this topic. And this was very important, not because it provided an overview of the project and the topic, but also because it gave us, policymakers, an argument and data we can actually utilize. So this happened in 2019. We all know what happened in 2020, though. So this happened. So in terms of healthcare, and many of, during the welcome remarks, touched upon this, we know that COVID has had direct and indirect effects on our health, both physical and mental. And these are just some of the reports and some of the articles on this topic. So this is kind of like part of the impact of COVID on our lives. And this is part of the impact of COVID on culture. We know that the cultural sector was hit hard by COVID. It was one of the sectors that had to shut down first and the longest, because it requires that we people, like here, congregate. And during COVID, that was not a very good idea. So, especially in Greece, this was a hard hit that happened after the crisis. So it was a hit after hit. So we had to figure out ways to kind of keep the sector going, not just the part, let's say, the cultural institutions that are supervised by the state cultural institutions, but also and primarily the cultural and creative industry. So you had two sectors, actually pretty much every sector, but these two sectors heavily impacted by COVID. So you have policy issues that have risen. One is the increased pressure on the healthcare system because of COVID. These data here are from 2013, so these are pre-COVID data, so imagine what happened after that. So these are data for Greece. There is a report that's saying that 14 to 15% of the population is facing some kind of a mental health issue. The severe, let's say, part is around 1% of that, but still, this is a big number. And also, 12.7% of the population has been abusing substances. And as I said, this is also on the rise because of COVID. And then, on the other hand, we had reduced revenues because of COVID and the lockdown in the cultural sector. Also, and everybody who is working in a museum or a cultural institution knows this very, very well. The donations and the sponsorships towards culture reduced because they shifted towards healthcare. So that was another issue. And also, we started, but also, like, there was a silver lining. We started talking more and more about the functional dimension of culture. We know, and we are very aware of the intrinsic value of culture, especially in a country like Greece. But talking about the functional value of culture has been, at times, even a taboo, as if this is something, bad that we should not be touching upon, and we should only focus on, let's say, the higher ground of culture. The yellow thing is, it's my bad, it should have been blue, but what it says actually is that we had to figure out ways to both restructure the way cultural institutions are organized, but also to identify new revenue streams for cultural institutions. So we're fast forwarding to the project, the RRF project, the Recovery and Resilience Fund of the European Union. For those who are not very familiar with this was the plan, the response of the European Union to COVID. It is a funding mechanism towards all EU state members, and it actually it is geared towards supporting the economies, the national economies, and different sectors of the economy to bounce back and to prepare, God forbid, for a similar crisis in the future. So we had the opportunity in Greece, the way the Greek government designed this, every ministry had the opportunity to actually propose its own ideas and, let's say, projects to be included in the RRF. And because of what I described before, we thought that this is a great opportunity to make a change, a very, very deep, systemic change in the way we see the connection and the relationship between culture and healthcare. Yes, there have been already a lot of projects and a lot of programs that cultural institutions and NGOs are doing, where you have music therapy, for example, or you have drama therapy, a lot of different things that are happening. But this was based on the initiative of each NGO or institution. It was not done in a concise way. It was not done in a way, it was not always done in a way that it had, let's say, the cultural component might have been there, but the health component, not always, and healthcare professionals were not always involved in such projects. So they were more like this, new age, hipster kind of avant-garde kind of approach to see, let's see what we can do, rather than a hardcore policy where you actually acknowledge the relationship and the direct impact of culture on health, and then you build on that. So the strategy is this, is to create an integrated, holistic, and concise policy that links these two sectors. So this is a joint initiative between the Greek Ministry of Culture and the Greek Ministry of Health. We actually even signed an MOU last year because if you want to create deep change, you have to actually, and you are working in public policy, you work in government, you actually need to get the buy-in from all the stakeholders. And we are very, very fortunate that we pitched this idea to the Greek Ministry of Health and they agreed there on the spot. So then we started building on this. This project will transform unavoidably both healthcare institutions and cultural institutions. It will require shifts in the way they're organized, in the way they operate, in the way they actually work. And it also requires a collaboration between healthcare professionals and professionals from the cultural sector in a way that has not been done before. Why? Because the end goal is to go to the cultural prescription. And by cultural prescription, I mean literally cultural prescription. Doctors, healthcare professionals being able to prescribe nationwide within the national healthcare system art projects and art, let's say, activities to patients. So this is reform. It's a reform of major proportions that maybe we have not even acknowledged yet the size of them. But so that is why it requires certain stages. First of all, you have to do research. There is research done, but not on how you integrate in the way we want to integrate culture into healthcare. Then you have to design the framework, and I'll explain to you in a minute what that means. Then you do pilot testing, then hopefully you implement, you set it up, so it works. So framework design, what that means. First of all, you have to define which cultural activities are eligible. Are we going to be prescribing everything? A visit to the museum, pottery, whatever. This has to be defined if you're talking about a concise policy. Also, who is eligible to provide this? Are they going to be licensed? Are they going to be, should anyone be able to do that? Should anyone be able to open, let's say, a healing center and say that, we're going to do, I don't know, drama therapy there? Is it working for every different ailment? Is it working for every different disease? And can any doctor from any kind of medical field should be able to prescribe arts and culture? And then you go to who is the beneficiary. Is it good for every patient? Are there selection criteria? Should there be any selection criteria? And of course, then you go even deeper and you say, okay, so we're talking about a one-off session. Are we talking about a long-term project? What is this? All of these, if we're talking about a reform, need to be defined. And this is actually what we're now designing. And then the yellow squares, you have everything else that has to do with, let's say, the legal and the public policy aspects of this project. So, for example, you have to pass a law for this to happen. But also, you have consent issues. Maybe you have to create registries, let's say a registry for eligible doctors or eligible cultural institutions that will be able to prescribe. So we're talking about the legal aspects, but also about how we are actually going to view, from now on, cultural institutions as healthcare providers. And what does that mean for cultural institutions themselves? Should they have a new department set up that focuses on this? Can they do it with their existing personnel? Do they need to train their people in a different way? Do they need to Can they just do it with external collaborators and healthcare professionals? And are there going to be, is there going to be like, in Greece we have a prescription, an online prescription system. So that your doctor prescribes to you medication, and you go to a drugstore, you go to a pharmacy with this prescription, this online prescription, and you get what the doctor has prescribed. The idea is to be able to do that also in cultural institutions. So they will be integrated into this system. And of course you have to monitor this. Is this working? Is this actually going to be a successful project that has a positive impact on the healthcare and well-being of people? It is important for us to do that for many reasons. There is also, and I will not lie about it, a financial aspect. Two of the reports that were mentioned at the WHO big report stated, one stated that the Art on Prescription project in the UK has actually said that for each pound spent on this program, you actually save £2.5, or you get £2.5 back, because you reduce the cost of having a population that is suffering from mental health issues, and you also reduce the cost of prescription. There's another also report that focused on children and young adults with depression and issues of adjustment, and it actually said that they monitored this project, and for every euro that was spent, the community essentially got back 7. So there is a dimension, a financial dimension in this as well. It will also help reduce the overconsumption of medication, especially for mental health issues. So we're going to also test this with pilot projects, both from state institutions, cultural institutions, but also other institutions will be eligible. There's going to be a call soon, within the next 2 months, hopefully, and cultural institutions like the Benaki Museum here will be able to actually apply to get funding to explore this and to get into this pilot phase of this that will be monitored by our research team. There's going to be a research team with cultural professionals, healthcare professionals, and even patients that is going to be monitoring the whole project. So we're going to have KPIs, indicators, we're going to test these projects, and we're going to see how effective they are. And we're also going to ask everyone involved, healthcare professionals, cultural professionals, patients, if this worked for them and what can be improved. I'll give you 3 quick examples, and with that I'll leave you, of such projects. One is from EMST. EMST is the National Museum of Contemporary Art. EMST was a ghost museum for 20 years. Now, not only it thrives, not only it had 50,000 visitors in the past 6 months, but it's the only museum in the European Union that is actually accredited and has designed itself in a way that is friendly to people that are in the spectrum of autism. But they're not stopping there, and we're not stopping there. The new project they're proposing is in collaboration with the Hellenic Society for Pain Management and Palliative Care, and what they want to do is a project focusing on chronic pain patients and their caregivers, sorry. And the idea is that these patients and the caregivers are going to be meeting with artists. The artists are going to provide stimuli, and they're going to help create positive experiences, and also they're going to help both the patients and the caregivers to express their emotions in a more effective way. So we're going to be launching this, but also we're going to be, as I said, testing this and testing how effective it is. And if it is proven to be effective, then this program will expand. Another example, the Athens State Orchestra. They want to work with a therapy center for dependent individuals, and they're focusing on chronic substance users because they feel that actually music, both as just the sound of it and the experience of music, but also the social aspect of music and attending a concert can actually help this population, A, improve their well-being, B, become more integrated into our society and to kind of lift the stigma that exists around them. And a third one, and I think we have also the director of the DISFF here with us today. DISFF is the Drama International Short Film Festival. Drama is not just drama, it's also a name of a city in Greece. So it's a short film festival that takes place there. And it's not as dramatic as it sounds, but it is one of the top 3 short film festivals in Europe. They have already been doing a project called Cinema Therapy, and they've been doing it at schools. The idea is now to use this to take it one step further. And the idea is that if you watch a movie, sometimes it makes the conversation easier afterwards with a professional, with a healthcare professional. Why? Because you have the, let's say, the opportunity to talk about the music, the movie, but essentially you talk about your issues, you talk about your emotions that were generated by the movie, and it eases up this whole process. So this is a relatively new tool that therapists are using, especially when they want to help some individuals open up. So the idea is to also test this concept and see if it works. There are other projects in that logic, and they're going to be, all of them are going to be tested. We expect that through our pilot projects, there are going to be around 5,000 people involved, 5,000 patients involved in this phase, and hopefully by 2025, which is not as far as it seems, we will have a concrete cultural prescription program fully integrated into our national healthcare system, but also going to have further scientific evidence on the impact of health, on culture on health. So we took literally what the WHO prescribed, and I think we are, if not the first country, one of the first countries that were actually exploring this to that depth and to that also breadth, in the sense that this is not a regional project, this is not a project of a community, this is going to be a nationwide project. So this is what I wanted to share with you, and I'm open to any questions you might have. Thank you so much for listening.
Thank you, Mr. Yatromanolakis. Do we have any questions? Anybody would like to comment or ask something? Well, wow, I have a question. You were super clear, actually, and thank you very much. I do have a couple of questions, if I may.
Of course.
As always. I was wondering if you're planning to somehow incorporate the knowledge and the experience of existing programs, those random but kind of effective programs that do exist already in museums, from what I know, but I'm sure other stakeholders as well.
Yes, and some of these projects that I shared, they are building on previous or pre-existing programs. The problem with many, or the issue, not the problem, with many of these previous programs is that there is no data after, or evidence on the impact that they had. So maybe a cultural institution ran this project. They did it. They did visits in healthcare facilities or in other places. They had small educational other projects, but they didn't. Most of them, not all of them. Some they do have data, but most of them don't have data. So part of this concept is to actually monitor everything in a far more meticulous way, so that we can actually contribute to the global research on this topic.
Mm-hmm. Yeah, it would be interesting, even now after they've been going on for years to collect the data, even post.
Yeah.
I mean, I think of the the Benaki Museum and the programs that we have for the people with sight issues, seeing with the senses, but also for the people with dementia. And I'm sure, I don't know if my colleagues are here yet to say, we're going to discuss it later during the round table. This is knowledge that should be
absolutely
collected.
In my opinion, there are three types of data. So one is, and what is usually being collected is, the sheer number of participants. Usually, I used to work in a cultural institution. I know how we measured. We just said, 50 people participated in this event, and that was that. Sometimes maybe we had nice quotes from them, oh, this program changed my life, or changed my day, or, made my day, and that was that. And there's a data of this. It's this kind of data. But if we're talking about systemic or like programs that we want to actually monitor their actual impact on a person's health, this has to be done in a far more meticulous and scientific method. But what I think is also super useful, and we can use this knowledge, is the experience of not only of the participants, but the organizers or the facilitators of this project.
Exactly.
And they can share with us their experiences, and we can definitely learn from them.
Mm-hmm. Excellent. We do have a question over here. Yes, if you could take the mic.
Hi, thank you for an amazing presentation and an amazing program. A little bit following on what you opened, my question would be if, since in my experience at least, this problem of evidence-based, of gathering evidence, is mainly an infrastructural, a resource problem. So I'm just wondering if what you're working on now puts in any way the basis of any sort of infrastructure for gathering this evidence, which can actually feed back and can benefit these smaller, non-systemic projects that you are talking about. So whether as an effect of the cultural prescription program that you're implementing, there will be any sort of resources which the smaller organizations, smaller initiatives can benefit from in order to improve their gathering of evidence.
If I understood correctly, so if there's going to be, in addition to developing programs, if there's going to be special funding for infrastructure, so for example, improving
the way you gather evidence, for example, very specifically.
Okay, in that sense. Yeah, this is part of the scientific program, and there's a scientific team that's going to be running this, so they're going to be doing that, and they will create protocols that will be used to collect data and evidence. So I don't know if that answers your question. In terms of physical infrastructure, this project has a little sibling, not a little actually, they're twins, which has to do with universal access to culture. And that is an infrastructure-heavy program, and has to do with how people with any type of disability can access culture, not only as consumers of culture, but also as creators. So what we're doing there is improving infrastructures in terms of, does the museum have let's say like a ramp, or do they have a system where they, let's say, I don't know, they have a hearing aid compatible system, or all these things. Also, this goes beyond institutions. So for example, we're doing a project with the Greek Film Center that we supervise on subtitling Greek movies so that people with hearing disabilities can actually watch them. So that is something we're doing in parallel with this. So we're hoping that these two projects, I mean, obviously there is a slight overlap in some ways, but we're hoping that one of the cultural prescription project will be more, let's say, active in the way culture is utilized in order to, let's say, in the medical process, in the healing process. The other one is about how you lift barriers that exist already in order for people with any kind of disability, not only to participate, but also to create.
Thank you. I will take, if you may take one more question from our online friends. I understand that it's by Noemi Abajo Vega. I understand that an evaluation system should be implemented. On the other hand, do you encounter barriers to the participation of the patients themselves?
So far, and now I'm using the data we have, or the evidence we have from pre-existing, let's say, projects that have been done from different institutions. No, there's always a resistance, when you try something new, and it can, and first of all, I want to clarify something. Nobody's telling you now, or telling now that, oh, we're gonna, stop you from taking medication X, and instead you're gonna be watching movies. That's not the idea,
great.
I mean, if it works, sure, but it's gonna be an auxiliary, let's say, an additional kind of measure that we're going to be utilizing. But this has to do also with what I said before, that there are going to be eligibility criteria. And it's not for everyone and should not be for everyone. The same way, not all drugs and not all therapies are for everyone. You customize, and depending on the problems and the issues every patient is facing. So far, we have not experienced so much resistance. I would say, on the contrary, we have seen a positive response, and because we want to make sure that the voice of patients is being heard, we have proposed, and I think it's a done deal, so I can share that with you, that the president of the Greek Patients Association will actually be a member of the steering committee of this project. So it is very important to include every stakeholder in such initiatives, and that's why we're doing that.
Thank you very much.
Thank you.
Mr. Yatromanolakis. We'll be happy to hear your next steps, and we're always here as a platform also to communicate them.